everyone. Welcome. My name is Amir Rand, Regional Director here at Spear Physical Therapy. We are just giving a few more minutes for those few people that are straggling in late to get started, but we'll be right back with you soon. All right, sit tight. Good afternoon, everyone. My name is Amir Rand, physical therapist and regional director here at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We appreciate you taking the time to learn with us about the foot ankle. So for those of you who don't know who we are, Spear is a private outpatient practice that has been around for about 20 years with currently 20 locations located all over the New York City metro area. We have continued to offer in-person care through the COVID-19 pandemic, and we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone within our clinics. For more detailed information on the safety measures we are taking, please visit our website at spearcenter.com. We have also launched Spear Live for those of you who are looking to stay in the comfort of your own home and receive care there. This gives you the opportunity to receive physical and occupational therapy treatment through our telehealth platform from any device. We are here for you in whichever way makes you feel the most comfortable. So if you're looking for individualized care, please reach out to us and at your convenience, and we'll get you set up for an appointment right away. We are here with you today because since the COVID-19 pandemic started, we know there are a lot of people who do not have normal access to providers for in-person care. And at the same time, we have a bunch of unanswered questions about the foot and ankle pain and injury prevention. Our team of clinicians got together and have collaborated today to provide you all with educational information and to answer frequently asked questions that you may not have been able to find answers to previously. We created today's talks specifically for you and are coming to you live from our own homes. We do not anticipate any technical issues today, but please be patient with us as we navigate working through this new technology. As part of our session, we'll be talking through demonstrations, some exercises and stretches, and we really look forward to you following along and participating. I promise this will not be like your typical Zoom meetings that you've been experiencing. Please note that if you are experiencing any pain while performing any of the exercises we demonstrate for you today, that you please stop and reach out to us directly so that we can support you. You can do that in the chat feature to all panelists, and we will support you there. Lastly, some housekeeping items. Throughout the webinar, we want to hear from you. So if you have any questions, please feel free to let us know your thoughts in the Q&A feature down below. So please take a moment to look at that. And if you have any questions, place them in the Q&A feature there. Should you feel the need to chat with us, that will be in the chat feature by clicking on all panelists, and we will address your issues there. Let's see. For those of you who are watching on YouTube Live, we are monitoring the comments section there as well, so please feel free to type your questions in that section. Okay, let's talk about what our goal is for the day. What you can expect from us. We will first discuss the basic anatomy of the foot-ankle complex. We'll then shift gears a bit and talk about three more common foot-ankle injuries and how to prevent them. And then lastly, and most importantly, we want to get you moving today. So we'll be reviewing some exercises that'll set you up with a preventative routine at home. All right, let me introduce to you our team. First, let's talk to and say hello to Gwen Giffard. Gwen is a physical therapist of ours at our Murray Hill location. Hey, Gwen.
Hi, how you doing?
Good, good. Odalise Figueroa, she's another one of our physical therapists. She works at our Upper East Side location. Hey, Odalise.
Hey, Amir. Hey, guys.
And last but not least, Don Squire is a physical therapist and clinical director from our Penn Plaza location. And Don will be working behind the scenes with me, helping us answer your questions in the Q&A today. What's going on, Don?
How's it going, everybody?
All right, let's get started. Gwen and Odalise will now take the lead and get us started with our anatomy review. I shall see you guys a little bit later when we address the Q&A stuff later on today.
Thanks, Amir. Hello, everyone. I'm so thankful to have you here. And Odalise. So what we're going to do is just to get the wheels turning, just to see kind of where you guys are at already with the foot and ankle, is I want to pull up a poll. All right. So this is just a fun little thing. Just again, get thinking is kind of how many bones do you think make up the foot and ankle complex? Now I'm talking about one foot only, not both together. I'm not trying to make it more complicated than it needs to be. So go ahead. You have about, a little bit of time just to go ahead and pick what you think. Is it 5, 18, 26, 35? You tell me. This is going to kind of get us to segue into what we're going to be discussing in this next hour. So I think, oh my God, fabulous. We have the results in. Most of you think it is 35. And then we have a few with the 26 and the 18. So it is C, 26. We have 26 bones in the foot and ankle alone, which seems exorbitant. I remember learning that in my anatomy class, and I was like, holy smokes, how am I going to remember all of this? So what I want to do, though, is I want to kind of make it a little bit more simple for you. What we're going to be talking about are some key muscles and one key ligament, and that's it. So even though that's a whole lot of bones, right, and they're stabilized by the little ligaments and the muscles, we're going to talk about the calf. So I'm going to use Odalise as my foot and ankle model. Odalise, all right, so can you help me, please? We are going to show them first our big old calf muscle. So where's that?
All right, guys, let me pull up my pants. Their calf.
Perfect. So the muscles of the calf come together and they form what we call the Achilles tendon. Can you show me where the Achilles tendon is, please, Odalise?
Yep, so I'll turn around for you guys.
I love the different visuals and angles. Yes, that is our Achilles tendon. And I'm sure most of you have had some kind of pain there over time if you're a very active person, whether a runner, a dancer, just someone that goes to the gym, our weekend warriors. So what this does is it helps when we're pushing off. It does something called plantar flexion. Just keep it simple, it points your foot. Odalise, can you point your foot for me? Yes. So the other way is when you flex it and then point it. So that's what your calf muscle does. Perfect. So we're going to keep moving down into the foot. We're going to talk about really briefly the plantar fascia. The plantar fascia is, Odalise, my model. Perfect. It's that just bottom portion of the foot. And what that does is, it's funny enough, not a muscle. It is a connective tissue and it acts more like a tendon. So what it does is it helps stabilize all those tiny, itty bitty little bones we talked about, all 26 of them, right? When you're walking, when you're standing, it acts as a shock absorber when you're landing and running. It helps to push off when you're running. So the plantar fascia gets a lot of use out of it on a daily basis. Maybe not for those of us, some of us that are working home these days, but when you're going out for your 1 hour daily walks, right, you're using that plantar fascia. So we're also going to talk about that a little bit more. Last but not least, we're going to talk about a ligament, right? So we just went over muscle, we went over a little bit of tendon areas. The ligament that we're going to be talking about for short, we're just going to keep it easy, is your ATFL. And Odalise is pointing to it right now. And it's just, I mean, it's a really small ligament. It just connects a couple of those bones in the foot and ankle, but it is the most affected ligament when you roll your ankle. And that, rolling the ankle is one of the more traumatic injuries we tend to see in physical therapy. It's quite painful too. So our goal with you today is to address these certain areas. And what we want to do is give you a couple of different exercises you can be doing on a daily basis to prevent any injury in these areas. So what I'm going to do is I'm going to send it over to Odalise, and Odalise is going to get us started.
All right, guys. So to get started, we're going to talk about preventing plantar fasciitis. But before we get you up and moving, we're going to take a quick poll question and see what you guys think plantar fasciitis is caused by. Is it stepping on a Lego? Is it a muscle strain? I think Gwen helped us out with that one. Is it overuse or having flat feet?
Have you ever had plantar fasciitis, Odalise?
Luckily, no, but I know many people who have.
Not the most comfortable of injuries to have. Definitely not fun.
Yep, I hear that from a lot of people. All right, so actually most of you guys got this right. Over 50% chose overuse, but a good amount also said flat feet, muscle strain, and awesome. We only got 2 people saying stepping on a Lego.
You know what? Stepping on a Lego could cause it. It's that painful.
It is very painful, although that's temporary pain. And for plantar fasciitis, not caused by flat feet, although that's a very popular opinion. People with high arches can also have plantar fasciitis. It's all about how that load is distributed when you're walking. And it's not a muscle strain because the plantar fasciitis is a connective tissue, as Gwen demonstrated. It's a ligament. So it's often caused by overuse, and it's usually those people who start walking or increasing their running mileage too soon. That repetitive pounding over time causes inflammation down into that plantar fascia. Okay, so to get started, we're going to show you guys a nice quick stretch for that plantar fascia, and we're going to have Gwen be our model.
Oh, we're just switching back and forth. All right.
Yep.
I'm going to move my computer, because who has a
Gwen?
That's good enough for this stuff, right?
Yep. So you guys can do this virtually anywhere as long as you have somewhere to sit. So what Gwen is going to do for us, and I hope you guys are following along at home as well, or at work if you're at work. She's going to put her foot over her other knee. Nice. And if we can remember, the fascia runs from our heel all into our 5 toes. Yep. Gwen is demonstrating nicely there. Awesome. So to stretch it, we're going to grab onto those toes, all 5 of them. And really simple, we're just going to push back towards the shin. Nice. So you should feel a good stretch depending on how tight it is in there, in that arch, along that fascia. Awesome. So typically I hold anywhere between 15 to 30 seconds to start, as long as it feels good. And then I relax. And I actually do this one for more than 3 to 5 times, usually 10 in the morning if I want, and then again throughout the day. If you guys want to make this a little bit more, if you want to get a little bit more of a release, you can use your thumb. So again, we'll use our thumb there and then just press along that fascia.
Oh boy.
Nice. So start off gently first, because it can actually be a little bit uncomfortable depending on how tight it is. But you can probably find some trigger points in there, some knots, really tender areas. Looks like Gwen needs to stretch her plantar fascia. Maybe some of you guys at home as well. So same thing here, hold for 15 to 30 seconds and then release.
Whew.
Awesome. All right, so now that our fascia is nice and loose, we're gonna get into strengthening. So we'll start with strengthening our foot intrinsics, which are our small muscles within our feet. And they're really important for stability, for gripping the ground, and overall decreasing load in our foot. Our foot get a lot of work throughout the day. All right, so we're going to start off with the first one called doming, and our goal is going to be to increase our arch. So Gwen is going to be our model for this one as well.
I did my toes just for this.
And yep, so the goal here is going to be to activate that arch, which is often neglected, especially because we're often in a shoe, in a sneaker, slippers at home. So those feet don't get a lot of work. All right. So what we're going to have Gwen do is think
Is this
about.
a good angle, Odalise? I just want to make sure everyone can see me.
Yep, that's really good. Thanks.
Perfect.
All right. So we're going to think about bringing the heel bone and the ball of the foot closer together without curling your toes.
So none of that.
Yep. So that's really easy to do. Harder if you do it by keeping your toes flat on the ground. So Gwen is doing a nice dome. It might be a little bit hard to see, but she's increasing that arch there. You can see a little bit of a dome compared. Maybe when you can show the other foot to compare. So flatter on the left, more dome on the right. So she's gonna hold here to start 5 to 6 seconds, and then she's gonna relax.
Whew.
Nice. Some people, depending if how tight it is in there, if you're not used to using this, you might get a little bit of a spasm or a cramp in that arch, which is completely normal. All you're gonna do is do that fascia stretch that we just showed a second ago. Nice, hold 15 to 30 seconds, and then get back to doming.
Oh my goodness.
So I typically start off with 10 to 15 with a 5-second hold and then bump up from there. And if you guys want to challenge yourselves, you can also do this in standing, which requires a little bit more work since you have resistance from your body.
I am standing. You can't see it, but I promise I'm standing.
Nice. And this is a nice, easy one to do if you're bored at work. If you've been sitting for a long time, you can just work on the doming. If you're washing dishes, cooking. All right. So next up on our foot intrinsic strengthening is our toe yoga, or otherwise known as our toga. We're going to focus specifically on our toes. So we're going to have Gwen and you guys out there following. Think about keeping your 4 small toes on the ground and just lift the big toe up.
Oh my God, my toes are gonna get camera shy. I'm so afraid.
There you got it. Nice. That is beautiful. She's making it seem easier than it actually is. If you can, you're gonna hold up there for a few seconds, 2 to 3, and relax. All right, so common compensations are rolling your foot out to try and get that toe up. Yep, just like that. So if you're doing it that way, you're cheating. You're not really getting that good toe work in there, but I know it's hard. Good. And then from here, we're going to do the opposite. We're going to think about keeping our big toe down and bringing our 4 toes up. Nice. And depending on the person, one might be easier than the other. This one specifically is really challenging for me for some reason. So this is the one I focus on. Nice. That looks beautiful.
More challenging for me too.
Doesn't look it. Why I had Gwen do this because I'm not really good at these. All right, last one in our toga is going to be toe spreading. Okay, so toes are going to be, you got this, Gwen, are going to be flat on the ground, and we're going to spread them out.
Whew.
And then relax. So
Oh my
trick
God.
here is to keep the toes on the ground. See how they're coming up? It's really hard, really challenging. Oh, there, she got it.
Ah.
She's
Told you
gonna
they were gonna
hold.
get camera shy.
It's okay, they warmed up. She's gonna hold a few seconds and then relax. And same thing as the other ones. I usually start off with 3 to 5 second hold, start off with 10. If you're feeling good, you can do 2 or 3 more sets of these.
Oh my goodness. I think I'm gonna
Awesome.
I'm calling it a day. Those were good enough for me.
Awesome.
Yeah, those will make those feet burn.
Oh yeah, it definitely is much harder than it looks. All right, so that was exercises and stretches for plantar fascia. And now we're gonna have Gwen show us some great tips for lateral ankle sprain.
Yeah, so we wanted to, Odalise and I, we wanted to be able to give you something. Oops.
Hey, Gwen, sorry to interrupt.
Yeah.
I've been aggregating questions for us for later, but I do have a question about the last exercise I thought it was appropriate to bring up.
Sure.
So the question is, for the second foot exercise, how do you get the ball of your feet closer to your ankle without curling your toes?
Ooh, good question. So if you guys have a pen or a pencil at home, you can use that as a cue. To start, sometimes I allow people to do the curling just to get that motion and then work your way up from there. Try and keep those toes on the ground. You can even put like a quarter at the bottom of that ball of your foot, the bottom of the first toe, and try and keep the quarter on the ground as you bring those bones together. Okay? Does that make sense?
One other thing I do want to mention is we're not bringing the heel closer to your ankle. We're bringing the ball of the foot, which is right below where those toes are, right? We're bringing the ball of the foot closer to the heel. So if your feet are flat on the floor right now, what I want you to imagine is you're trying to lift that arch just a smidge more away from the floor. It's like you're lifting that arch away. You're just not scrunching the toes in the process.
Right. Thanks, Gwen.
Perfect. I hope that answered your question. Keep them coming. We love questions. So what we'll do is we will move on to lateral ankle sprains. We're just slowly moving our way up into the foot and into those muscles and areas that we mentioned. So lateral ankle sprains can be really painful. And I can understand maybe the wheels turning, being like, well, how can you really prevent an acute injury from happening? You don't really have that much control over this particular type of injury. The thing is, what we can do is prevent the severity that the injury becomes, essentially, right? You can roll your ankle one day walking off the side of a curb. That's kind of like a freak accident. But what we can do is really make sure that your ankle joint and the muscles around it and the ligaments around it are there to stabilize you really well, so that you don't end up with a severe ankle sprain and maybe you just get a more mild, kind of like low-grade sprain. That's what my goal is with you. So what I want to do is we're going to talk about mobility, flexibility, right? The difference is one is joint versus muscle, and then strengthening. And we're going to try to combine these all together. This is what's going to help prevent a more severe ankle sprain. And so, Odalise, as you guys can see, I think already what the pattern is one of us talks, the other demonstrates. So Odalise is going to be my model. We're going to start with something a little easier. Now I can understand that the positioning of this next one might be a little uncomfortable. There are many modifications that you can make. So if anybody has any questions, go ahead and put that in your Q&A or anything like that. So what we're going to do is we're going to grab a long bath towel, a beach towel, a fuzzy blanket, whatever you got nearby, right? All of these things we want you to be able to do at home. So Odalise, I'm going to have you grab your towel and we are going to go over a self-mobilization. Woo! So just making sure you have mobility in that ankle. What we're focusing on is just being able to flex the foot a little bit more, essentially getting a little bit more of a stretch in that Achilles tendon area, but making sure your bones in that joint are nice and mobile. All right. So Odalise, you are going to come into a kneeling position for me. Excellent. You're going to wrap, oh, careful. You're going to wrap that middle portion of the towel, whatever you've got in your hand, perfect, right where the crease of the ankle would be. So it's right between the foot and the leg. Excellent. What you're going to do is cross those two tails, if you will, in the back. Now what you're going to do is use that kneeling knee, kneel right on it, kneel right on those tails. Good. So now you know where to go. You're just going to kind of walk your, so you're demonstrating this with the right foot. Woo, balance forward a little bit. So it feels like you can't move anywhere.
Can't move, stuck.
Does it feel okay?
Yep, it's good.
Good. I hope everyone's doing this with us. I know this is probably going to give you a really big stretch. And it might even feel a little stiff. That just means you need it probably a smidge more. So what we're going to do now, once you're in this position and you're ready to go, you're going to keep your heel down and you're aiming to bring that right knee over your toes, but keep the heel down. Good. Odalise, what are you feeling?
Ooh, I feel some stiffness.
Where do you feel the stiffness?
Right in here.
Cool. So the stiffness is in the front.
Yeah.
Is in the back. That's what I want everyone feeling right now. Yes. Awesome. Perfect. So we're just mobilizing your ankle joint, right? It needs to be able to move. It's super, super stiff and you try to roll your ankle, it's just going to kind of collapse on you. So what I want to do now, let's stabilize. We're going to work on balance. It's the biggest thing you can do to help your ankle be nice and strong when you're doing any random sorts of movement, running, jumping, skipping. I don't know who's skipping these days, but man, if you're skipping, that's awesome. You got a lot of energy. So what we're gonna do is we're gonna grab a slider. We're doing something called a slider lunge. However, I don't have carpet in my apartment. So when I do these, I kind of take that beach towel, regular towel, a face towel, anything that slides, a slippery sock, doesn't matter. That's what we're gonna use underneath your foot. And Odalise is gonna go ahead and stand up for me. And we're gonna do this in 2 different directions. That's because we're going to challenge. Oh, you got it? You got space?
Got it.
Amazing. So we're doing this in 2 different directions to challenge all of the muscles around that ankle. Even though we talked about pointing, right? Foot and ankle points, flexes, and it goes side to side. So we need to make sure we're activating all those muscles that we didn't really discuss today. Again, it was a crash course, not an in-depth anatomy course. What we're gonna do is, Odalise, the foot that does not have the slider is your foot, all right? That's the one that we're gonna be working. And we're gonna lunge starting to the side, meaning the slider, the foot with the slider under it, is gonna come out to the side. You're bending that standing knee, beautiful, almost like a side lunge. Excellent. And then let's just, you know what? We're gonna make it a little bit more challenging. We're gonna go backwards. We're gonna bring the same slider foot, you're gonna bring it behind you. You're bending either just the front knee, or if it's a little easier, your hips or anything, you can bend the back knee as well. Trying to bring that back knee down to the ground.
Nice. This feels good, one.
Yeah, I'm gonna one up it. All right.
Okay.
Remember the doming, everybody, that we did with Odalise when we were talking about our arches and the plantar fascia? Let's introduce the doming while you're in standing.
Okay.
What that means is you're gonna just try to lift that arch a little bit. You're engaging it. So we're working that bottom part of the foot. Now we work all of those outside muscles. So a slider lunge plus doming.
Wow, this is definitely much harder.
And you might feel a little bit more wobbly if you've ever had ankle sprains in the past, right? We kind of had this chronic feeling of, giving way. This is the perfect exercise for you. And you can just go to the side if you want for 10. You can go to the back for 10. My typical go-to, whenever I'm talking about strengthening in general, is 3 sets of 10. But it definitely can't hurt to break it up. You can do both together. You can do 20 in a row. I'm not going to be too picky on it, but what I don't want you feeling is any significant pain. So why don't we say like 3 sets of 10 when you're at home, doing this as part of your strengthening routine. Okay, how you feeling, Odalise?
Pretty good. Definitely got to work on those.
Cool. So last but not least, we are going over, let's go over, what was my third exercise? Oh my goodness, I'm blanking. We're gonna do, Odalise, can you help me out?
I think we're going to do airplane. Is that right?
Yes, thank you. I knew I was doing one more balance. So what we're gonna do is an airplane. And usually I'll use this with my more, elite athletes, but that doesn't matter. We can break this down. We can modify it. We can do things that make it feel better for you, but still challenge you. So we're going to kind of give you the harder version of this. What you're going to do is standing on one leg. All right. I think Odalise is picking her left leg. Fabulous. You are going to bring your arms out.
I'm going to pick my right leg.
She changed her mind. Her leg is her right leg's probably the stronger one.
It is.
So you're going to bring those arms out in the shape of a T. What you're going to do now is hinging forward, bringing your body parallel to the ground. And notice she's swinging that back leg out behind her. Good. And then she's trying to touch the floor. So she's trying to bring those hands down to the floor, fingertips touch the ground, and then she comes back up. And she's an airplane.
Nice.
I wish we were on an airplane right now. I could.
Me too.
How does that feel? Feels okay?
Feels really good. Yeah.
Cool.
The fun one.
You can also do doming here, right? Anything where you're trying to do a single leg exercise, if you just dome, you get that extra oomph, that extra pizzazz where you're working on that ankle just a smidge more. So what I want to do now, those were some of our exercises. I hope you guys have been able to do them. And if you have questions about them, we're happy to answer them. But what I want to do is actually get a quick poll and get you thinking, all right, let's say you get a gosh darn lateral ankle sprain. You're walking to Trader Joe's, your local grocery store.
Oh, love Trader Joe's.
Around, and you end up stepping off that curb, like I mentioned before, and boom, you've rolled your ankle. You've got some swelling and a lot. what are you doing the moment you get home? Obviously, if you can't really walk on it, these might not be for you. You might want to call the nearest physician or head to Spear Physical Therapy, right? But I just really want you to get you thinking, okay, what should I be doing at home if this were to happen to me? And you can get home comfortably and safely. Excellent. Oh my God, you guys are fantastic. Thank you. It is all of the above. So rule of thumb, rice. It's delicious. It's nutritious. Sorry. So it's the best way to treat this ankle sprain. You are going to rest. You are going to ice it. And even better, you're going to wrap that ice around it, super compressed. And then you're going to elevate your foot. Typically, it's above the heart. That way, swelling can start to kind of circulate through your legs. So again, rice is rest, ice, compress, and elevate. Fabulous, everybody. I hope that you guys are sweating because me just talking, I'm sweating a little bit. Now we're going to go over our last and final topic. So Odalise, take it away.
Thanks, Gwen. That was awesome. All right, guys. So we're going to get into Achilles tendonitis. And then we're going to take a quick poll question one more time before we get you guys up and moving again. All righty. So this is a nice and easy one. Or not easy. I should say fast to answer. Maybe not easy. Do we think our calf has 1, 2, 3, or 4 muscles? Are we thinking?
So many muscles in that lower leg area. Oh my goodness.
So many muscles and bones, as we learned
A lot of bones.
in the beginning.
Lots of bones. Yes. I wonder what most people think here. Have you ever, oh, wow, that was so fast, guys.
Nice. All right. So most people thought 4. Second most popular answer is 3, which is correct. And then 2 and 1. All right, guys. So we actually have 3 muscles in our calf. Number 1 is the gastroc, which runs from our knee into our heel. Then we have the soleus, which goes right below the knee into our heel. And then the last one is a teeny tiny muscle that most people forget about, called the plantaris. Not that important, so understandably so. Not many people know it exists. And fun fact, about 7 to 20% of us don't even have a plantaris. So that's why we neglect it most of the time.
No way. I mean, I knew it wasn't that important, but really, that just solidified.
Not that important, but we still shout it out and give it some love.
Amazing.
All right, guys. So to start, we're going to get right into strengthening. We're going to do heel raises in a sustained bridge. And as you guys probably know, Gwen is going to be my model here.
I'm going to move you guys
over. This is
over.
a great one because we're strengthening the calf, which is really important for Achilles tendonitis, right? Usually people with Achilles tendonitis do overuse activities, like they up their running, they up their mileage in walking, and their calf might be a little bit weak. But here we're going to do heel raises with a bridge. So we're also targeting other muscles in our hips and knees, which are also super important. All right. So Gwen is in a perfect position. We're going to have you guys start with your flat on the ground.
Make sure they had a good angle.
Perfect. Back is flat on the ground. Feet are also flat. Before you start, make sure there's no arching in the lower back, which some people have. From here, we're going to squeeze those glutes, those muscles in our butt, and we're going to drive those hips up towards the sky. Nice. And then here, we're going to raise our heels and bring them back down. Keep that bridge, and we're going to have you guys do 10 heel raises in a sustained position.
Oh,
nice.
boy.
Common compensations are shifting of the hips, turning. Try and keep that hip nice and squared. You can tuck in your core here as well. Think about bringing your core towards your spine. Nice. Are we halfway, Gwen?
2 more.
Nice.
Oh my
So
God.
typically I start off with 10 to 15. We'll take a break. And if you guys are up for it, usually I do up to 3 sets to begin. You guys should definitely feel your calves burning if you're following at home, and also your glutes as well, possibly your hamstrings. So again, this is a great one because most people who come to us with Achilles tendonitis have weakness in other areas of their body, which are really important to address as well. All right, so we're going to keep you guys moving, and we're going to stand and do another exercise called farmer's walk on our toes. So a regular farmer's walk is just walking forward with weights on either side of your body. We're going to spice it up just a little bit and do it on our toes. Nice. So Gwen is gonna hold on to light weights if she
I
has
do have light weights.
any.
They're in this bag.
Nice.
Yeah.
So you guys at home, if you don't have any dumbbells, any kettlebells, you can use anything available to you. Cans of soup, water jugs, juice jugs, whatever
Ankle
is
weights. We have
ankle weights. Anything equal in weight that you can hold on both sides. She's gonna stand nice and tall. Yep, and walk forward on her toes. Nice. So you guys should feel those calves burn after a few steps. And this is a really important one for strength. But also very important for endurance, right? Our calf is really important for endurance, especially for runners out there. You're out there for a while. You want to make sure those calves are working the whole time. So typically I tell people to start off and see how many minutes they can hold it for. Maybe you can walk for 30 seconds, maybe a minute and 10 seconds.
Gosh.
After you do that, you can compete with your own self. So see if you can walk the next time, maybe a minute and 30 seconds. Okay, as long as you feel those calves burn and you're doing it for time versus for repetition to address endurance. Good, Gwen?
Oh my God, they're burning.
Good. Yeah, you can have fun with this. You can do a model walk, you can do backwards walking, sidewalk, you can dance. All right, guys. Last thing here, we're gonna do a calf stretch. So this is a common one. Most people know about it, probably are already doing it, but we wanted to go over because we wanted to emphasize the importance of keeping your calf flexible for Achilles tendonitis and other foot ailments as well. Okay, so this is also called a runner stretch. All you need is a wall or something in front to lean into. And we're going to show this two ways. We find that most people stretch their calves with their knees straight, which addresses one of our calf muscles, but also important to do with the knee bent, which we'll show you guys in a second. So we're going to have Gwen bring one foot back, one foot forward. Awesome. Her back foot is straight. She's going to keep her heel on the ground. We're not going to lift. And back knee straight as well. She's going to shift her weight forward, bending that front knee until she feels a good stretch in her calf. I feel like I can even see that stretch from here.
Yeah,
Okay.
it's really stretching after the,
Yeah.
the
If you guys
walking
are
heel raises, absolutely.
exactly perfect swag way. So we're going to hold for 30 seconds. And typically we do this 3 times. So that's the first one, stretching our gastroc. Okay. Now we're going to go into our next calf stretch, which is going to stretch our soleus. Same exact exercise. We're just going to keep the back knee bent. Okay. So her back knee is bent. She's going to shift forward. And she's going to feel a good stretch. Typically, you probably feel this lower in the calf.
Yeah, I usually feel it right around there.
Nice. Perfect. She's going to hold for 30 seconds. And also do it 3 times. All right. So if you guys do this at home, don't forget to do it with knee bent. Okay. I think that's why probably people don't feel too much of a release with their calf because they're only doing it one way. Awesome. All right. Thanks, Gwen. I hope you're nice and loose there.
Oh my goodness. Well, yeah, I think I'm gonna need to do these a little bit more often. A little tight today.
All right. So that's all we have for you guys in terms of tips and prevention. We're going to bring back Amir so he can facilitate some questions that we may have in the audience.
Ladies, how are we?
Fabulous.
Good.
A little
That was awesome.
toasty, but you know,
Yeah.
you know.
That's why I kept my AC on.
That was awesome. You definitely generated a fair amount of questions across the board. Some are a little specific to individuals' needs, and we have Don in the back end helping those people out. So
Awesome.
just be patient. If he hasn't gotten to you yet, he will shortly. There's just a fair amount of questions that are super specific to you. So just hang tight for Don. But let's get going. I've got a bunch of questions here for you guys. Okay, so bear with me as I kind of thumb through them here.
Sure.
That's good.
Here's a general question for either one of you. Someone wants to know if you have any recommendations on how to improve circulation in the foot.
Yeah.
Take it
So-
away.
Many ways. A nice simple one that we, depending on the stage, of course, that we give to people to improve circulation is called ankle pump. So if you're on the side of the bed or you have anywhere to elevate the foot, all you're going to do is pump the ankle up and down. And you can do a lot of these throughout the day. Okay. It's going to circulate some blood flow in here. You can also do ABCs, so making alphabet with your foot. Okay, and then last one is rolling the ankle. If you want to up it a little bit, even doing heel raises will improve some blood flow in there as well.
Yeah.
And you can also get some strengthening at the same time that you increase blood flow.
Cool. All right, here's a shift of gears here. This is a philosophical question, I believe, as well. What's your take on walking barefoot? In your opinion, is it beneficial or harmful?
It's natural. It's definitely, I mean, that's how we walk. I feel like a lot of us, there was this period in time where we had those shoes that were supposed to, you know, there was a little segment for every toe. I forgot what they're called. And super flat-footed, and they're supposed to make it feel natural when you run and stuff. I think walking flat-footed in your apartment is fine. Obviously, if you're having any random discomforts and pains, right? I mean, I guess you could bring it up if it's a little bit more consistent, but it's not bad. That's how we're supposed to walk, is, you know, we can walk barefoot.
Yeah.
Yep.
Cool. Yeah, I know for folks who are dealing with some plantar fasciitis, walking barefoot in the morning first thing, it's certainly going to hurt more.
That's true.
Your question is related to that. That could be something separate.
Yeah.
Right.
Let's see here. Well, this is a little related. So, as a barefoot runner, what are the best exercises I can do to keep the foot strong?
Ooh.
So that
Yep.
doming
Yeah,
is gonna
you can-
be your best friend.
Yeah, and doming, I would say if you're running while doing standing activities, doming while doing a side lunge like Gwen
Yeah.
showed us, you can dome and do some side leg lifts. You can do even though it doesn't look like much, doing the toe yoga also works a lot to keep your foot nice and strong.
When you're experiencing that, when you're running though too, it could just be from all the tension and the tightness that you're experiencing after a very long run, depending on what your mileage is like. So doing the stretch that Odalise mentioned, and even, you know, rolling your arch on a ball or a water bottle, just to kind of keep things nice and flexible in there, also helpful. So you want a nice healthy balance of flexibility and strength.
Yeah, this one probably applies to a lot of people, so I think it's worth talking about. Someone asked a question from earlier on, so you were doing an exercise. It says here, is it unusual if you can't do the toe spreading?
I barely can do the toe spreading.
So
Not
I'll
at all.
admit, I've had practice as a teacher. I was practicing those at a very young age. So you can see how I was struggling to do it, and I've been doing them since I was about 10 years ago. We'll just say that.
Yep, not unusual at all, guys. For this one, I promise you, the more you do it, the better it gets. Some of it is more about that brain to muscle connection. You just need to kind of like put some effort and focus, and it'll get there. Even if it takes you 20 tries, I promise you, if you're doing this consistently, you'll be able to do it.
Yep.
Cool. Let's see here. When you have plantar fasciitis, it is I say that word pretty frequently, and it's still tricky.
Tongue twister.
Yeah. Is it better to do as little walking as possible?
Depending, I would say depending on the acuity of your pain. If you're taking just 15 to 20 steps and each one is painful, or if you're doing a lot of standing at work, maybe take some sitting breaks. All in all, though, I usually tell people to get up and moving and address like flexibility, address strength. I think if you're sedentary and don't do much about it, it might be worse. But of course, if it's too much and you're finding like every 5 to 10 minutes that you're walking, you're getting pain, then I would suggest some rest.
Cool. We've got a lot of questions about falling arches. Someone here wants to know if a falling arch is normal as we age.
I think, do you mind, Odalise, if I take this one?
Yeah.
Falling arches are natural in someone with a high arch. So I, for example, have a very high arch, and it took me a while to develop the strength in it. That being said, right, Odalise mentioned in her poll question that flat feet or falling into the arch they kind of go in hand in a sense. They aren't going to necessarily create that plantar fasciitis discomfort. It's not always bad. It's just your body mechanics that change over time So you could get it when you're in your 20s, right? You can have that fall and arch, flat feet when you're 20, and it's just going to stay with you for a lifetime and you never get pain. But then all of a sudden it happens in your 30s, 40s, 50s. All of a sudden it's a lot of pain. And that also just depends on what your activity level is, what you're doing during the day. So really, it's not bad that it happens. It's natural. It's just what ends up happening when you get that flat foot or fallen arch.
Cool. Sorry if it looks like I'm not paying attention. I'm just scrolling through.
I know you're paying attention.
Like 50 questions here. It's great. Here's another one. Do you recommend foam rolling the calf muscles before a run or other exercise?
Yes, definitely. We actually almost brought that in as well, but we wanted to give you guys some time to ask any questions. But yes, we definitely recommend foam rolling. Typically, I do anywhere between 2 to 5 minutes before I go on a run, and I also do it afterwards as well, because you're pumping that calf muscle, gets a little tight, and then you release it after the run as well.
Yep. Yeah. I just don't want you to also fall back on only doing foam rolling, because foam rolling and stretching, they both have their different benefits. So you still should be doing both, but foam rolling is incredible. Yes.
Yes.
Here's a question here. Can you do these exercises if you already, I just lost it, have tendonitis or tendinosis, or are they strictly preventative?
Fantastic question, guys. So yes, you can definitely do these if you already have. So prevention, these are for prevention, but also we give them to a lot of our patients who already have Achilles tendonitis, plantar fasciitis. These are excellent overall to strengthen your foot and decrease some pressure in the tendon, in the calf, and in the plantar fasciitis.
And the thing is, like, one of the things that we had mentioned, right, is if you're having extreme pain doing one of them, maybe you just need to modify it. And obviously that's what we do at PT is, let's say, for example, I have someone that comes in and they can have a heel raise, but not a full one. I'm like, great, let's work with that half heel raise. Let's work into maybe getting to that full heel raise over time. So there's different modifications that you can do where you're still doing a very similar exercise, but it just might not be as intense. But yeah, no, I think it's great to do even when you already have these like tendinopathies, anything going on with these tendons.
Yep.
Cool. How about this one? Is wearing flip-flops a good idea? It's summertime.
Ooh, I think we have conflicting opinions on this one.
I think it depends on if you're wearing it all the time, if you're gonna like wear it a day to go to the beach, or if you just wear it to get your mail, to pick up the garbage, that's fine. If you're only wearing flip-flops the whole summer, then I would say that might not be the best. So I would say depends on the usage.
I also think there are some better flip-flops out there than others. I'm just saying maybe the $2 ones you get at Old Navy aren't going to be as good as some others. I don't personally wear flip-flops. I just don't know the best ones out there, but maybe the $2 ones that are just flat, not the best. But yeah.
Assuming plantar fasciitis hurts on the heel of the foot, how do you know if you have fasciitis or bursitis?
Great. So plantar fasciitis usually is pain in the inside of the heel. Bursitis, for what I've seen, typically is the back of the ankle. I usually see bursitis. I typically don't see it in the inside of the heel. So I think that's a way to tell. And then you can also test it out by doing the plantar fascia stretch. If you're feeling a little bit of tightness, a little bit of discomfort, that fascia might be uncomfortable. Another good way to tell is a lot of people with plantar fasciitis complain of pain during their first steps after waking up. Or if they're sitting for a long time and they take 2 to 3 steps, they're like, ouch, I really feel it. After you take maybe that 10th step or so, it gets a little bit better. That's the most common symptom and complaint. And then people will also say after 7 hours of being on my feet, I was fine for 5. Then I came home at night, my foot is starting to hurt again.
Yeah, bursitis would be pretty constant. Every time you put that foot down, it'd be uncomfortable.
Mm-hmm.
Cool. This is a question back to the doming. When doing the doming exercise with the sliders, are both feet doming or just the balancing foot?
Great question. Just the balancing foot. You can't really do too much of that doming with the other side. Also, we'd rather you focus on the side that you're working, right? And that standing leg is the leg you're working. So just the standing leg.
Here's a question I think I can answer and you guys can chime in. Someone is asking, and there's been several in the same sort of realm. Can some of these be modified to accommodate hip and knee problems? You know, the answer is definitely yes, right?
Mhm.
I just would be a little cautious to answer that in a sort of general way because it's so matters and it's so specific to you, the person. So if you are experiencing pain in other parts of your body, I would just recommend that you reach out to us, because I think just having, even if it's just one consult to understand what your specific needs are and how we can modify it for you is important. So I didn't want to disregard those questions, but that I think that answers a lot of people's questions that are very specific to them, and it's just a little tricky to answer in such a big blanket statement.
Yeah.
Here's a funny one. I like to walk off ankle sprains. Is that not ever a recommendation? Just walking it off.
I love that. Do you mind if I take it, Odalise? Or
Yeah.
you can, snowball off of it. I think that at this point, if you're getting that many that you can just walk it off, you probably have a chronic version and probably a lot of laxity in that ankle. Still something that we as physical therapists can kind of handle and get under control. I would still ice and rest it for a certain period of time, and I wouldn't walk it off and then 5 minutes later go, play basketball, do a layup, and then land on it again really awkwardly and walk it off and just repeat that cycle. You should definitely be resting it once it's happened. And then there are a lot of exercises, especially the ones we did today, even just doing the spider lunges, 3 times a week, 3 sets of 10, it'll really help.
Yeah, I would definitely address that.
Yeah.
Because once you have a lateral ankle sprain, even one, you're way more susceptible to having it again.
Yep.
So it can be a chronic thing over the years. Yeah.
Here's another good one I like. How long does it take? I think the person's saying plantar fasciitis to heal.
Oh,
It depends.
it depends on the person. Yeah.
It depends on if you're the type of person that has a job, maybe like if you're a mailman or someone that's on their feet, you're in the service industry, right? If you're on your feet all day, that's going to be a lot tougher to manage, and it might take a longer period of time compared to someone that can take that break in the middle of the day because they're really just on Zoom calls or, just kind of for the majority of the day. So it depends. I've seen people get over it or like have it healed essentially like over with in 4 weeks. And I've had people that do have it for a prolonged, 4 to 5 months. And it's also dependent on how long you've had it for. The more chronic an injury in any state, in any case, is going to take longer to reduce symptoms and kind of get back to what was, your prior level of function. It really depends on the situation.
Yeah.
There's a fair amount of questions as well asking us about if we'll be sending a list of these exercises via email. The answer is yes, we will. As well as several people asking for recordings. We have been recording and you will be able to access that as well. I think we have time for maybe 1, maybe 2 more. One question is, what is foam rolling? So you guys can take that.
That's a great question. I know. Shouldn't assume everyone knows. I think Gwen is going to get her foam roller.
My handy dandy foam roller. It was right in my little corner of knickknacks and whatnot. So foam rolling is usually just rolling back and forth with the foam roller, with your body weight through it over the foam roller. So for example, if you're doing your calf, right, I'm going to kind of, I'm going to sit this down. I've got both calves on it. I'm going to lift my booty up and roll forward and back.
Yep. You guys can even turn like left or right, get different parts of the calf.
Yeah, turn the feet
If
out.
you're doing the calf.
There we go. Foam roller.
All right. Are there any good stretches for the front of your ankle?
What was that, Amir?
Are there any good stretches for the front of your ankle?
Yeah. A nice simple one, depending on your flexibility. Sometimes I just have people, depending if like the front of the ankle is tight, just like sit on their heel.
Yeah.
Yep. So you're getting nice, good stretch in here. Even me doing this, I feel a good stretch. Okay. The one that Gwen showed us to begin with was really good.
Mm-hmm.
I don't know if you guys can see the dorsiflexion one. That's
Go
a
with the
really good
towel.
one. Yep.
And then Odalise, I was even gonna say, when you're doing the one for the plantar fascia, when you're sitting there, you know, on the most boring Zoom call of your life, just go in the opposite.
Yeah.
So I think she's gonna demonstrate. Perfect. Yeah. So instead of pulling those toes towards you, you're actually gonna bring them away. That makes sense, like the away, right? So you're gonna point and kind of place more pressure through it. So you're just going in the opposite direction. So you can actually, you know, kill two birds with one stone.
Cool. I think that's all the time we have for questions. So I do want to say that we hope that today's talk was valuable and that you learned a few ways to prevent and perhaps even manage some of the symptoms you may be experiencing, as well as better understand the foot-ankle complex. If we didn't get to your question, we will do our best to reach out to you directly afterward. We will also be sending a handout of the exercises we covered and some important facts for you to have as a reference. Again, as an orthopedic outpatient physical therapy practice, we treat an array of conditions from head to toe. So we're open for in-person visits as well as for telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out. We're trying to rebuild our practice from the times that we've been experiencing, and we have the rare availability that we normally don't have. So please reach out to us. We'd be happy to support you. Thank you for spending time with us today. We hope you enjoyed our webinar. We sincerely hope you the very best. Be well, be safe and healthy out there. And hopefully we see you in one of our centers soon and get you back to life and back on your feet. Be well, take care.